Hello there, Justin Brock here with Bobby Brock Insurance. We run Go Guru and Bobby Brock Insurance here in Tupelo, Mississippi, and we help Medicare beneficiaries all over the country, as well as people shop health insurance with the Affordable Care Act and off-exchange products through carriers like Allstate, United Healthcare, etc. And today I'm going to be reviewing some articles. Something that I like to do is take the industry buzzwords like Medicare, Medicare Advantage, Affordable Care Act, Obamacare, throw them into Google, hit news, and see what's popping up in the headlines. And I'm going to start off today just going over kind of a macro view of the difference in the headlines when I do that with search terms Medicare and search terms Affordable Care Act. And what I'm trying to do is get the disparity in political coverage, or kind of the algorithmic coverage of these two topics. Okay, and before I do that, I want to compare these two programs. Medicare, or Medicare Advantage, is what will widely be covered on here. Medicare Advantage is privatized Medicare. It's where a beneficiary can elect to choose a Medicare Advantage plan, taking themselves off of traditional Medicare and be on this plan that is still regulated by the Center for Medicare and Medicaid Services, has to cover services covered by Parts A and B, but there are some nuances to the program. By the same accord, the Affordable Care Act is another private-public partnership where a plan is subsidized by the federal government for health insurance based on income, and people under 65 not eligible for Medicare or Medicaid, in most cases, can get an Affordable Care Act plan, that sliding scale coverage and sliding scale premium. Both are private companies involved in two different programs. Now, Medicare Advantage started much earlier and has been evolving for a long time, and also, of course, affects the senior market population. But it was started under Republican leadership. It was a Republican initiative, whereas the Affordable Care Act was largely a Democrat initiative. Was actually signed into law under Barack Obama. I just think it's interesting. So right now, this is end of 2023, and we are under the Biden administration, and it is really funny to watch how the news outlets cover the different things going on. So first, pull up I'm pulling up the search term, the Affordable Care Act, and as you'll be able to see on my feed here, the top links are: Covered California urges uninsured Californians to get affordable health insurance. Number 2 is CAP's role in affordable health care. Number 3 is Walmart expands health insurance reach in Florida. Number 4, the New York Times, open enrollment begins for Affordable Care Act health plans. Number 5, The Hill, Biden touts Affordable Care Act enrollment spike. Number 6, CNBC, as open enrollment begins for Affordable Care health insurance marketplace, here's what you need to know for 2024. NPR down here, open enrollment for 2024, ACA health insurance starts November 1. And The Hill again, this year's Affordable Care Act enrollment is different, what you need to know. And then finally, Kaiser, last on this Google page is Kaiser Family Foundation, what to watch in the 2024 ACA open enrollment. Great, these are awareness type of articles. I see nothing wrong here, other than when we compare them to the Medicare Advantage world, which these are largely the same corporations involved in the Affordable Care Act as are involved in the Medicare Advantage world. Medicare Advantage, top article, and this is paraphrased, I believe, from a USA Today breaking article by Stat News. It says, United Healthcare sued over algorithmic Medicare Advantage plans. If I go down beyond Stat News and get to health payer intelligence, avoidable hospitalizations less common in Medicare Advantage. That one is actually one of the lone positive ones here. Kiplinger says Medicare and ACA call center workers strike. What you need to know. We'll go over that article a little later. NBC News, new TV ad targets Speaker Mike Johnson on cutting Medicare and Social Security. We'll go over that one as well. And then as you round out this one, we have lawsuit accuses United Health Group of using faulty AI to deny claims. And bottom here, Modern Health it's a paraphrased article from Kaiser Family Foundation. Actually, this is talking about Kaiser Permanente. Kaiser Medicare Advantage ratings dipped due to staff shortages. So a lot more negative content here. I'll also skip this one from Stat News. It says United Health used algorithms to deny care, staff say. Okay, so a lot of negative press coverage related to Medicare Advantage. And if you keep going on Medicare Advantage, what you'll see is there's a common trend of a little bit of informative things being paraphrased in the news side here, but a lot of negativity. Why is that important? Now, we offer, a lot of our customers are on traditional Medicare with Medicare supplements, but there are some times that Medicare Advantage, and oftentimes for people all over the country, that Medicare Advantage plans are a viable option. And what we're seeing is when we have a Democrat, led, government, under like the Biden administration, for instance, we see a negative spin on Medicare Advantage more prevalent in the media. And then in general, even when Republicans are in office, we see a lot of negativity from media outlets that are maybe largely left-leaning towards Medicare Advantage. Whereas at the same time, on the Affordable Care Act, we see largely positive things from these media outlets, other than maybe the couple of right-wing, mainstream news outlets that are out there that would be negative on the other side. The answer isn't right or left. This isn't Republican or Democrat. The answer is that both of these programs help a lot of people, and it's unfortunate that any of them are covered negatively. They should be covered honestly. The Affordable Care Act plans actually have more limited networks than Medicare Advantage networks the majority of the time. So it's interesting that there aren't a lot of articles that get paraphrased talking about network limitations related to the Affordable Care Act, but they do get published all the time and get thrown up in these feeds related to Medicare Advantage. So I wanted to kind of show that contrast as we get into some of these articles, because some of them are interesting. Okay, so the first one I'll pull up here is Medicare and ACA, Affordable Care Act call center workers strike. So right now there's a strike from the federal contracted call center that helps people enroll and service their existing Affordable Care Act plans, as well as things like claims related to traditional Medicare. And this call center is called Maximus. They've been doing this for a while. And in fact, a couple of years ago, I remember them having a strike again, where our office is in Mississippi, a few hours away, I believe Hattiesburg or Vicksburg one, they have an office there. And I remember them striking in that one. But they had 700 workers walk off the job, calling it, and we call this the largest federal call center strike in history. These workers at call centers in Arizona, Florida, Kentucky, Louisiana, Mississippi, New York, and Virginia. And the Communication Workers of America said that adding the Mississippi and Louisiana centers were largely completely shut down during that time. This is in the middle of an enrollment period, so a lot of people are having to get things done. And of course, the public position was that there was no delays in enrollments in essential benefits. Of course, I don't know how they would even know that this fast, considering that this was pretty quick. But that would be a good official position to take, I would think, to try to downgrade this. So it's funny because, Joe Biden was recently at the auto workers union and was supporting that union when it had to do with private entities paying them more. We'll see how he responds to this one that's asking the government contractors to pay them more, because government contractors are federally funded. They're asking for wages to be $25 per hour, which the Communication Workers of America said is commensurate with what federal employees doing similar work are paid. Ensure that workers have affordable health care, investigate racial disparities and potential obstacles to equal employment opportunities at Maximus, and investigate Maximus to ensure it is a responsible federal contractor. That's what they're asking. So that is It's interesting for this. They like, I think this happens a lot in the enrollment period because it's when it puts the most stress on the government. But it's also when like probably 80% of their job is done. So it's pretty burdensome. You know, one really blatant issue I see here is right now the Center for Medicare and Medicaid Services added some compliance regulation last year to agents and brokers that on every call, at the beginning of every call, we have to, and even on our websites and marketing pieces, we have to say that we don't offer every plan. Even if technically in that area we did offer every plan, we have to say we don't offer every plan, and we have to tell them if they want every plan offered, they can call 1-800-MEDICARE or go to medicare.gov. Which, we have lawyers looking into the legitimacy of being able to do that. We think that there are some unfair, trade issues related to that statement. But we do have to say that right now. And it is funny because the call centers that they're telling us to tell them to call are striking, and some of those centers are completely shut down at times. And so, I guess if some of those people listen to that disclaimer advice and call those centers and don't get an answer, I don't know. Hopefully they will call back the agent that told them that so they can still get help, because most agents and brokers offer almost all plans in those areas. Most do these days. There are some captive agents that offer less, and there are some brokers that offer less than others. But one thing you can do is ask your broker how many of the plans in that area do they offer? How many Medicare Advantage plans, how many Part D prescription drug plans, and how many of the Medicare supplement carriers do they offer? So moving on, we have the United Healthcare lawsuit article. So this has been breaking, and a lot of extremely anti-Medicare Advantage agents and brokers, or pundits, if you will, out there are talking about this. So United Healthcare faces class action lawsuit over algorithmic care denials in Medicare Advantage plans. United Healthcare is the largest Medicare Advantage insurer, and it certainly invites class action lawsuits just by the sheer volume and size of their organization. We live in a litigious society, and I'm not saying that nothing wrong was done here, but we don't want to jump to conclusions and basically, before any trial or any real rebuttal has heard, just assume that the most negative, right? At most, after reading it, there's some potential middle management wording on the requirement to use the recommended algorithmic response to when someone should have their rehabilitation care denied. What we see is rehabilitation or skilled nursing care continues to be one of the pain points of Medicare Advantage. And I think it's, in our eyes, mostly because traditional Medicare has always been so loosely defined how to approve these claims. And so the facilities that are submitting the claims for skilled nursing care and home health care as well are used to traditional Medicare approving almost everything they send through. And they'll use words like they do in this article, we have a real live doctor recommending this. Well, unfortunately, that alone doesn't necessarily mean anything. And if you think it does, think about the fact that there are real live doctors that unfortunately commit fraud. That's just the way it is. So a real live doctor recommended something doesn't necessarily mean things. I mean, we had doctors that told us not to get vaccines. We had doctors that told us we had to get vaccines. We had doctors that told us not to wear masks. We had doctors that told us to wear masks. You have doctors that tell all kinds of different things. Doctors have dissenting and differing opinions, okay? And so I'm not saying there's no wrongdoing in this article. However, there are two chief complaints here. And those people potentially, very likely, did need continuing skilled nursing care. But the idea and the scariness of artificial intelligence or algorithmic responses being used in Medicare Advantage claims or health insurance claims or Medicare claims, even traditional Medicare claims, I don't think should be so scary. It's going to continue to increase, and it would actually be an efficiency metric. At some point it will get it will get good enough to probably do a better job approving than humans will. And that would be approving it or denying it, okay? Because it would be less emotional and more left up to the actual data of what is supposed to happen. Obviously, people think, hey, I want an emotional response, just like with a bank. I wanted the banker in there that can look me in the eyes and believe me. But some people can look you in the eyes and just be bamboozled. And unfortunately, a claims representative is not going to be anybody special. They're going to feel that sob story and want to approve someone that may or may not actually need the approval. So I think there will continue to be algorithms and artificial intelligence used in these processes, albeit probably getting better and better. In the meantime, we'll see how this lawsuit goes. It's an interesting one to take on, and I'm sure that they're trying to find more and more people to pile onto this. United Healthcare's position is that they haven't done anything wrong, and that they are going to. They said the lawsuit has no merit, and they will defend themselves vigorously. They do have some employees saying that they were told that they had to be within a 1% differential of what the algorithm recommended on these denials, and oftentimes the algorithm was stricter than traditional Medicare. I don't know when unfortunately on here they say some employees, but they don't really identify who those employees are, how many of them there are. So lots of unknown here. And so of course you can read into an article, and if you already believe this is happening, then this reinforces it. If you believe it's not happening, then you're just think, oh, that's a lie. But if you think, hey, there can be bad and good. Do I think that that there's some sort of systemic evil where they're thinking, how can we sign up the elderly and squeeze every dollar out of them and never help them? No, I've been to the United Healthcare's national marketing organization rollouts, and I can tell you that the employees that I've dealt with there that are national sales leaders, product design specialists, chief distribution officers, the president of the Medicare and Retirement Division, all have a heavy emphasis on increasing the quality of care and increasing the quality of their product, the customer service, and the benefits that they provide people. So in my eyes, in watching this, United Healthcare is doing a great job, as well as several other carriers. We partner with Aetna, Humana, and none of them are perfect. And everybody, if I told you every story that I'd heard from a beneficiary, I've had beneficiaries that hated Aetna. I've had beneficiaries that loved Aetna. I've had beneficiaries that hated United Healthcare. I've had beneficiaries that loved United Healthcare. Hated Humana, loved Humana. Hated Mutual of Omaha, loved Mutual of Omaha. There's no carrier that I've ever had been contracted with or presented that there aren't some people that love and some people that hate. But I will tell you this. There's always way more people that love the carriers nationally that we deal with than hate them. That's the honest feedback. However, a dissatisfied customer is 15 times more likely to tell someone than a satisfied customer. And so if a dissatisfied customer tells 15 people and a satisfied customer on average tells maybe one person, then bad news travels faster. And that's why the news loves to give us these daunting, awful things. Speaking of daunting, the next article that I found is about the daunting task of navigating dual eligibility. So there's 12.5 million people in the country that are dually eligible for Medicare and Medicaid. And this article from Stat News is summarizing an article previously put out, and it's about someone who worked for CMS, the Center for Medicare and Medicaid Services, and says even they struggle to help their family navigate dual eligibility. And this is true. Like 17% of the Medicare population is made up of dual eligible people, but they account for 33% of Medicare spending. Dual eligible people are just more likely to have health issues, more likely to utilize more aspects of their health care. And the rapid evolution of dual special needs plans in the Medicare Advantage market has led to a lot of great additional benefits for the people that qualify for them. But qualifying them for them is difficult because there are so many levels of Medicaid. You have full benefit dual eligible, qualified Medicare Medicaid beneficiary, qualified Medicaid beneficiary plus. These are different levels, meaning some of them qualify for full full dual plans, or some of them qualify for partial dual plans. And then if they stay on Medicare and state Medicaid, that can look differently depending on what level they have. Is their Medicare Part B premium paid by Medicaid? Are their drugs subsidized? What level do they have? And navigating it can be cumbersome. You definitely need to work with a broker or Medicare directly, or someone who has tools to help you. And of course, as I said earlier, the disclaimer, you can call 1-800-MEDICARE, and as long as the strike isn't getting in the way, someone should be able to help you there, or you can give us a call over at Bobby Brock Insurance, and our team can use tools to help you as well. All right, so going on to the next article, and this is one of the few that popped up that was a positive Medicare Advantage article. It's talking about avoidable hospitalizations, less common in Medicare Advantage. And when they started diving into this, it was about the fact that with a managed care plan, more people were incentivized or pushed to go and see their primary care doctor and be navigated with one doctor who's actually helping them control the overall outcome of their health care, instead of hopping around to multiple doctors with varying opinions, and also going to doctors that weren't involved in some of these networks who have higher rates of avoidable hospitalization. These are hospitalizations for blood pressure related issues, COPD, diabetes, asthma, heart failure, all that kind of stuff, right? And so this is a positive thing. This is actually something that's supposed to be happening. As more people go on managed Medicare Advantage, the idea is that if we can begin to manage healthcare outcomes, we will reduce claims for people, not by just not paying claims, but by keeping them healthier and identifying issues sooner. That is what the Medicare Advantage push is about. And the funding to those plans, is there enough to give you maximum out of pocket on your Medicare Advantage coverage, where under traditional Medicare, you actually have to buy a supplemental product to protect you from the unlimited or uncapped out of pocket potential. So pretty neat article there. That's on healthpayerintelligence.com. It could be some other places too. A lot of these articles get cited around in different areas. All right, just a couple more here. Actually, just one more article here, and this is about that TV ad that's being ran about Mike Johnson, the Republican in Louisiana, who was just made speaker, and this TV ad targets him, and we've seen a lot of TV ads like this. This one is talking about saying that Mike Johnson has voted to cut Social Security and Medicare, but he has voted to cut taxes for billionaires and large corporations. Okay, so let's talk about that. People say that, and probably to the untrained ear, it sounds bad. Why would you cut Medicare and Medicaid, but then lower taxes for billionaires? There's no bill that's initiative is, hey, let's lower some taxes for billionaires. Hey, you guys, let's sign this. Not at all. So what they're talking about is bills that have tax cuts in general, in them, right? And so these tax cuts that are out there that are being voted on, it's so funny. You could have 10 people read the same tax bill, and 3 of them are going to say it's good and it's helping the middle class. 3 of them are going to say it's bad and it's helping the billionaires. 2 of them are going to say, well, it does some good things for the middle class and some good things for billionaires. And then 2 of them say it does some really bad things for billionaires, but it does some good things for middle class. Like, you're going to have these dissenting opinions about what that bill really does, because these are complex bills. These suckers are 300, 400, 500, 1,000 pages long. They plop them on desk 48 hours or 24 hours where you got to vote on them. So it's a crazy process all around. But the idea that these bills are cutting billionaires and large corporation taxes is typically not true, or it's cutting to one small faucet of a bill versus the overall concept of the bill. Republicans want lower taxes and lower expenditures. That's what they want. They want more people to keep their earnings and be able to reinvest them in their businesses, which they think will drive a positive capitalistic response to the free market economy. Whether you believe that or not, that's what they believe. It's not about billionaires getting richer. It's about that trickle down economics. And we will hear from some Democrats that'll say, hey, trickle down economics has been tested. It doesn't work. When they say it doesn't work, if you just believe, oh, it doesn't work, what makes you think it doesn't work? I believe it does work. I've seen it work. The more money I've made, the more I've been able to pass on to employees, the more people I've been able to hire. I don't know how that's not trickle down economics working. So I'm going to definitely align a little more on the right side of that argument. But then we'll go over here to Mike Johnson cutting Social Security and Medicare. First, let's what do they mean by cutting Social Security and Medicare? Some people hear that and they think he's going to cut out Social Security and Medicare. That's not what they're saying. First of all, they're trying to say that he's cutting into Social Security and Medicare. So by raising what they call full retirement age on Social Security, meaning saying things like, hey, we think that instead of being fully retired at 66 years old in 4 months based on our budget running out or coming up on a shortfall in 2032, we believe we need to move that from 66 in 4 months to 67 years old for full retirement age. Not retirement. They can retire and draw a Social Security check, but that Social Security check will be a little higher if they wait until they're 67, so 8 months longer. That's the kind of thing that they're talking about when they say cut Social Security and Medicare. I don't know any Republicans or reputable Republicans that are quoted that are actually talking about cutting Medicare out or reducing Medicare. If anything, they might say more people should consider Medicare Advantage because private companies have better outcomes and in the long haul might be more efficient at managing funds than bureaucracy. That is a thought path. But these terrible muckraking smear campaigns on both sides are terrible because they're saying they're paraphrasing situations in a negative light about people who are up for re-election so that they can hurt them and get in. We just saw a gubernatorial election between Tate Reeves and Brandon Presley in Mississippi, and the ads were awful. I don't understand how they're not subject to lawsuits for libel and things like that, because the things they're saying about each other, they're asserting fraud and criminal and felony accusations for things that people haven't been charged for publicly and putting money behind it through super PACs, through their political action committees. And so I hate to get too much into politics, but basically just know that when you see an ad like this, there's a lot more to the story. And Mike Johnson is someone that I haven't studied intently, but I think he would be, there's definitely going to be some things that you're going to disagree with him on, that I disagree with him on. But is he trying to cut out Social Security and Medicare and take all the money and give it to billionaires and large corporations? No. Plus, large corporations are typically, or most often, publicly traded. And so it's not like there's a person most of the time that owns that corporation that is being rewarded by keeping their money. It just means that corporation is not having to pay C Corp taxes, or much C Corp taxes for money that they hold over and then use to reinvest at different times. And also a lot of these rich people that they're calling billionaires are people that are running businesses that are making $400,000 or $500,000 a year, $1 million a year, which is fabulous income. But are they billionaires? No, they're not billionaires, and everyone should believe in the American dream of being able to make that much money. That's nothing evil about making that much money. Okay, that's all we have today. I'm here, we're going to try to do this more often, where we have, updates and paraphrases of some of these articles that are coming out about the Affordable Care Act, Medicare Advantage. Lots coming out here in the annual enrollment period. If you have any questions about these articles, comment below. Like this video, give us a thumbs up if you want to see more content like it, and share it with your friends who might be confused about some of these topics. Share it with all your friends, and let us know if we can help you guys. So if you are a Medicare beneficiary watching this, or consumer, and you'd like help picking a Medicare plan from people who actually read this stuff, know this stuff, have insight onto what plans might be advantageous for you to look into, you can give us a call at 662-844-3300, or you can go to our website at Bobby, Bobby, Brock, Brock, Insurance.com. BobbyBrockInsurance.com. And if you want to know how good we are, Google us and see how many 5-star reviews we have on Google. Google Bobby Brock Insurance. You'll see almost 1,000 right now. We should be over 1,000 soon. 5-star reviews just on Google alone. Thank you so much for watching today. Please like the video and comment below. Even if you just liked it, give us a thank you comment because it helps the algorithm. Show this video to more people that might be helped by it. If you're an agent who wants to plug into a hierarchy that actually knows how to help agents and actually understands this market and loves this marketplace and wants to help more Medicare beneficiaries and health insurance beneficiaries, head to justinbrock.com to check out our Medicare agent ecosystem. Thank you guys so much for watching today.